I'm Judy Walker, and I'm an after action review conductor and an after action review trainer. I've been many other things as well. I started in the NHS straight out of university and worked in pediatrics, and then was asked to join a team that was looking at introducing after action review into the NHS. That was in about 2009. An after action review is a way of learning using 4 questions. But the key thing about the after action review, it's a psychologically safe environment where those 4 questions are asked of you and others by an AR conductor. So essentially it's a group learning process as the individuals learn from each other's expectations and each other's experiences, and then work out together what is the difference between what we're expecting and what's actually happened, and therefore what have we learned from this. So it's always those 4 questions, and it's always a group discussion, and it's best led by an external facilitator. The information is available already to help keep our patients safe, but we're very poor at actually putting that into action. And I learned that in pediatrics because there was a lot of research showing that if you prepared children really well for a procedure, if you use play to help them with teddy bears and dolls and stories to help them know what to expect when they were having an operation, that you would actually, the children would recover quicker from the operation. They'd have a lower incidence of post-op infections, and they'd go home sooner. All of that research was available in the 70s and 80s. But what I realized was people didn't listen to it. The standard model of pediatrics was you don't tell children anything because they'll get scared. And you'll hold them down if needed. And you'll anesthetize them if needed. It's the knowing doing gap that is the problem for patient safety. Very, very often, it's the implementation gap that is the issue. And I learned that very early on. The most fulfilling part of my job currently is seeing people learn how to help others learn. Training people to be after action review conductors is transformational when they get that if they ask a good question, the individuals will work things out for themselves. And there's such joy to see those light bulbs go off in a team of clinicians or a team of business people when they are in an after action review and they get those insights for themselves. It means that patients are safer the moment the AR is finished because the learning has taken place in the AR. So that is deeply satisfying when I'm helping others to create those conditions for learning in an after action review. I think what we know is that, the NHS is under enormous strain. So I think one of the key challenges is the PSIRF offers a significant opportunity to do things differently. But because the system is under such strain and stress at the moment, it's hard for people to have the capacity to try something new. And when we're under pressure, as individuals, as organizations, we tend to default to trying to do what we've always done. But what COVID taught us was actually you can do things in all sorts of different ways. And this is, I think, the shift that's needed. We can let go of some stuff, and let go. And the PSIRF gives us permission to let go of doing huge numbers of patient safety investigations, incident investigations, it's given us permission to have a more proportionate response. So I think is the challenge is for organizations and teams and individual leaders to actually be courageous and let go of other ways and move forward to this lighter touch way of learning that takes the learning down to the, to the pointy end of care, to the people on the ward. Reports can capture and, summarize the learning, and obviously sharing information with families and patients is absolutely crucial. But the real change comes from the people, not from the paper. So I think that mindset of that traditional mindset of regulating everything and having everything reported and documented, that will keep us safe. That's a real challenge. We do need to let go of that and recognize and trust that the staff on the ward, if you create a 15-minute huddle after a patient fall and ask them the 4 questions, so what would we normally be doing to keep a patient like Mr. Smith safe? When he's admitted to our ward, what would we normally expect to do? And to listen to each person. That might include Mr. Smith. It might include his daughter. And then to ask, so what's actually happened? What actually happened, this morning with Mr. Smith? So we can all hear for ourselves. And then to ask, so what was getting in the way of us achieving those expectations? So everyone has to decide and discover and articulate it together. And then, so what are we learning here? And what might we do differently? That 15 minutes is like gold because of the level of reflection and insights that's built through that conversation. Nothing else is needed. No bit of paper is needed. People get it for themselves. And we know that the research is really clear on this, that group sort of conversation leads to phenomenal amounts of change because the individuals have learned it for themselves. Next time they think, I better stay with Mrs. Jones when she's before she comes out of the loo, because I know she's very unstable at that stage. It's that sort of thinking. Well, I do truly believe that the patient safety incident response framework is a once in a generation opportunity because it allows that more proportionate response to learning at the team level. And I can say that with, the real insight into having seen it happen time and time again in clinical settings where the AR gives people an opportunity to walk towards the issue and learn from it together and move on. So I think that's, the next few years really holds an opportunity to do something quite different and just to slowly let go of those old sort of anchors of we've got to have an investigation for everything, we've got to over report it and write everything down, and move to this much more democratic. And this is what happened in the British military and the US military. They did this exact shift away from that over documented lessons learned procedure to a battlefield end of the day review. So the troops on the ground learned for themselves what they needed to do differently. Have an after action review every day. Whatever topic it might be within your, you could have it part of your MDT discussion. It's that engaging the good minds of the people on the ward. None of us is as wise as all of us. We can solve this together. So I think that's just do one thing. It would be hold an after action review to learn from successes and challenges. outside of work, I learned how to row, and I'm a very competitive athlete. I know that doesn't sound quite the right word for a woman of my age, but I row 5 days a week. I train 6 or 7 days a week. And rowing has taught me an enormous amount about patient safety, because it's a team sport. You have to win, you have to do it together. You know, we watch the Olympic athletes in their rowing boats and they make it look easy. Every single moment, you know, action is so synchronized, whether it's the 8 or the 4 or pair or double, it's so synchronized. And I've learned that as we're, you know, if you are that synchronized, then you can really go effortlessly through the water and win races. But in that journey to get to that place, learning how to work as a team, there's 3 responses that happen in a boat. And I've heard all of them and heard myself do all of them. One is to blame other people. Well, if only her in seat 4, you know, could get her act together, then this boat would go fine. Then there's also, well, if only I could get my act together, then this boat would go better. So blame yourself or blame others. Or the other response is, what can we all do to make this boat go faster? And it's only when you move into that space where you're problem solving together that you can make the boat go faster. And that's what we do with patient. That's the thing I've learned about patient safety, is to reach that place with people, and you can solve so many problems.